change in the world of medicine. The Food and Drug Administration has approved limited use of the painkiller OxyContin for children. FDA officials say there will be strict limits on the use of the drug because it's highly addictive. It will only be prescribed for children 11 and older. Lisa Lowery, Division of Adolescent Medicine, Helen DeVos Children's Hospital, joining us now to talk a little bit more about this. Thank you for joining us today.
Thank you.
It has been quite a reaction on social media about this as soon as the announcement came out. This is a drug that has really been troubled with an addiction problem throughout most of society. Then you hear it's been approved for kids 11 to 16. What do you make of that?
Well, as one of my partners and I were talking about it earlier today, we don't want it, I'm sure that the FDA didn't want it to become, street drug use, but it's going to be a tool to help in those cases for palliative care, cancer, severe pain related to trauma, surgery. So it should have some limited uses.
Limited uses, yeah. Has there been a shortage of effective pain medicine for children in that age group, 11 to 16?
Well, I think for some of the long-acting medicines, there's definitely a shortage. And so most of the medicines that are approved are more short-acting medicines. So this does give us a tool that gives us maybe limited, like once a day or even twice a day dosing.
It is considered highly addictive.
Yes, it is.
Is it going to have a stronger impact on a younger person who is still developing?
Well, not necessarily. And again, the use is actually for children that have already been exposed or have been treated with OxyContin or like substances. So, and it also used in the proper context with the proper persons who've had experience, with pain medicines. So I think it could be used safely in those cases.
Is this like a last-ditch effort to really find something effective for someone who's in a lot of pain?
It could be used that. We want to provide pain and comfort, but at first we want to do no harm.
Right.
So I think if we use it in the right context with the proper training and the right people, then I think it's just a great tool that we could have.
Is this something that doctors have been talking about?
Well, I think the biggest thing is we want to provide adequate pain control for our patients, and we know that providing long-standing pain control is a great benefit. It helps with healing, it helps with recovery, it helps limit depression. So when we have those type of things available, we really should look at it as a resource.
What is the difference between OxyContin used for younger people and the drugs that are used now? Are they just not as effective and that's why it was brought into the market?
Not necessarily not effective, but again, shorter half-life, and so this gives us a longer maybe limit, so we don't have to prescribe it so often during the day.
Okay. Something to watch and see.
Yeah. Yes.
Okay, Lisa Lowery from Adolescent Medicine at Helen DeVos Children's Hospital. We appreciate your thoughts on this today.
Thank you.
Thank you for coming in.